Oral questions by members.
Member for Skeena.
Thank you, Mr. Speaker. Government services are failing people, and as a result, people are dying. Diane Chandler died in one of this government's showcase supportive housing sites, and her body was left in her room for 11 days before anyone noticed. Her son Tyler is here in the gallery today. He told me he doesn't want another empty condolence or carefully worded excuse. He wants accountability. The minister loves a victory lap, I know, but today is not the time. Her son was devastated by the answer he gave last time because it did not offer closure. If this government has nothing to hide, will the Premier explain how Diane Chandler died in provincial care and why her son didn't find out what happened until a month later?
Minister of Housing.
Thank you so much, Honourable Speaker. And we did have a discussion about this topic, and my heart goes out to Tyler, to his family. As I said then, I'll say again now, it's unacceptable for this to happen. What I can share with the member, which I have shared with the member, is that when this incident happened, BC Housing reached out to the provider to find out what the issue was. There was an error made by, a clear error made by the folks that work for that not-for-profit. They thought that they had seen the woman in question coming in, and clearly they had not. The policies have completely changed because of that incident in all supportive housing sites. Now, every single supportive housing site is required to have a wellness check done on every individual in the room every 24 hours. They're required to monitor people as they come in and out and verify who they are. And that's not just at that site, but it's at sites throughout the province. And so, again, my heart goes out to this family. But this tragic incident has changed the way supportive housing sites operate, and now on top of that, every not-for-profit is required to inform BC Housing within 24 hours of an incident, and they have to have a plan to immediately notify family members, and that didn't happen in this family's case, and I'm very sorry for the family, but it has made significant systemic changes in all of our housing across the province since.
Member for Skeena supplemental.
Thank you, Mr. Speaker. With all due respect, I'm not buying it. Because in 2017, Sean Richards died in a supportive housing unit, and it took 3 days to find his body. And back then, his mother was told that changes would be made and that no family would ever go through this again. It was said then that it was going to switch to 24-hour wellness checks, and those wellness checks still do not address the root issue. What's the difference if somebody is laying dead in their room for 24 hours or 11 days? That person died. 7 years after this event, Diane Chandler died in similar conditions. Encouraged drug use, no permanent staff. She had a clearly, visibly deteriorating struggle with addiction. No one knew that she died because the staff allegedly mistook another resident for her during the wellness checks. That other resident tragically died a few days later. People deserve housing where they are supported, not just warehoused, and certainly not left to die alone in buildings where drugs are used, sold, and encouraged. If the government claims to care, why is the pattern not just continuing but getting worse? And how many deaths will it take before this government changes its approach to supportive housing and stops encouraging open drug use in government-run facilities?
Minister.
Thank you, Honourable Speaker. The member in her question stated a whole bunch of facts that I had shared with the member previously, which I appreciate the acknowledgement on. We made changes after this tragic death to the RTB to allow for all not-for-profits in the province to do wellness checks, which some argue that they didn't have the powers to do before. So it is a systemic change. The member also knows, because in estimates we discussed, that there are a lot of communities where we have supportive housing that has sobriety, where folks have gone through rehab and have opportunity to be in supportive housing where there's no drug use. And then we also have housing that ensures that we meet people where they're at. And if a person has gone through treatment and needs that housing, we're rapidly growing that housing stock at the same time. And the member knows that. Housing exists in different forms in different communities to meet people where they're at. And that's what we're trying to do with all of our housing. And the member can say it's housing that we've deployed. This has been a similar policy that was in place when the leader of the opposition was in government as well. Supportive housing was opened up all throughout the British Columbia in communities addressing encampments, and so it's very similar. The difference is we're scaling up opportunities for folks to get into housing when they've come through rehab as well.
House Leader of the Third Party.
Thank you, Mr. Speaker. The massive U.S. investment firm Blackstone, Inc. is the lead investor in the PRGT pipeline project. Blackstone is also a major investor in Canada's rental housing market, which is bad news for people who pay rent in BC. Blackstone's involvement in the rental market contributes significantly to rent increases and the loss of affordable units. And Blackstone buying pipelines in Canada is bad news for the cost of energy. It also means that benefits from these projects flow to mega billionaires, not local communities. My question is to the Premier, when will the Premier stop catering to Donald Trump's top donors on Wall Street and send his mega pipeline back for a modern environmental assessment?
Minister of Energy.
Well, thank you. And the member knows that the process is with the excellent staff of the Environmental Assessment Office right now. They're making a decision, a technical decision, around the substantial start of the process. So he knows that. I would say this, Honourable Speaker, here in British Columbia, in the last year, we put out a call for power that saw, approved by the government, at a size equivalent to Site C, 10 renewable energy projects. And we are taking action to ensure that those projects are built, Honourable Speaker. Those 10 projects are 51% owned, on average, by First Nations in this province, which indicates our determination to ensure that the wealth created in BC stays in BC equally, Honourable Speaker. As we've dealt with other energy issues, we have done exactly the same thing. Whether it has been on reviews of royalties and other questions, we are here to ensure that the people of BC get maximum return on the extraordinary resources of our province. We are building the province, and when we do that, we're doing it in partnerships with community, and in particular with First Nations.
Member Supplemental.
As the impacts of LNG are felt across the province, Mr. Speaker, we are face to face with the already tangible devastation this will put on our healthcare system. The Canadian Association of Physicians for the Environment continue to warn about the intensification that LNG will increasingly put on our healthcare crisis. As more LNG terminals begin operations, the collapse of our healthcare system is seemingly imminent. Physicians in northeastern BC have been closing their practices due to the growing health implications of LNG, with no additional support from government to address this issue. My question is to the Minister of Energy and Climate Solutions. As the government seems determined to continue on this LNG path, how does the ministry plan to recover the necessary healthcare costs resulting from increased LNG facilities?
Minister.
Well, I assume that the member misspoke. He understands that the first shipments of LNG have not left BC yet. So the health impacts to which he speaks that have occurred up to now, Honourable Speaker, clearly haven't occurred. Our approach to LNG is what we've said in this House a number of times, to focus on issues of climate change, yes, on issues of First Nations involvement. And the member asked the first question about involvement. The Cedar project is majority owned by the Haisla First Nation, Honourable Speaker. Perhaps he will be supportive of it, I don't know. So it returns to communities, returns to the province, jobs created. We have the lowest emission LNG in the world. And the actions we're taking in the upstream together with the oil and gas industry to reduce methane emissions are good for public health, are good for the province, and are good for everyone. We are leading Canada in addressing this question because we are working, yes, with First Nations, yes, with environmentalists, yes, with the oil and gas industry to ensure better results for everyone in our province.
Member for North Island.
BC healthcare services are failing. This government, after 8 years in power, is in constant crisis management in every aspect of healthcare delivery. Just one example of this failure is British Columbians stuck on wait lists to see specialists in cardiology, in neurology, in psychiatry, just to name a few. One pediatrician told me that her wait list has increased to 2 years. A patient in North Saanich, it took 8 weeks to get a lung biopsy, and 6 months later hasn't seen an oncologist yet. People in BC are suffering and getting sicker and dying, waiting to see specialists. This government's reassurances and platitudes are meaningless when people are continually falling through the cracks. So how long do the wait times have to be before this government takes this issue seriously?
Minister of Health.
Thank you so much, Honourable Speaker, and thank you to the member for the question. It is incredibly frustrating, I know, for patients to wait to be able to see a specialist, and to see them or a loved one in their family feel stuck on a wait list is a really hard thing to do. Now, Mr. Speaker, we are generally meeting our wait list times and targets for urgent cases, but we know there's a lot more work to do when it comes to improving wait times for non-urgent cases and for chronic conditions. And we have a growing, aging population here with more complex healthcare problems, and that means we need to continue to redouble these efforts, Honourable Speaker, and that's why we are doing all the work that is underway to attract and retain more specialists, more physicians, a recruitment campaign into the United States. Mr. Speaker, we're going to continue to hire cancer physicians, for example, and that includes 140 cancer physicians over the last couple of years alone as part of our cancer action plan. Mr. Speaker, we know there's an incredible amount of work still to do. We are working to streamline wait lists with health authorities, building more hospitals, adding more operating room capacity. We are not going to stop because we know that British Columbians deserve to get the care in a timely and equitable way, and that's exactly what we're going to stay focused on.
Member for Kelowna Centre.
With all due respect, Honourable Speaker, it's not just frustrating, it's life and death. Doctors in Kelowna found out through the media that pediatric services were being shut down at Kelowna General Hospital for at least 6 weeks. There was no official communication from the Ministry or the Interior Health. This means no pediatric care in one of BC's busiest hospitals. Parents, already in a terrifying situation, are now left in the dark. How can the Health Minister claim that the system is stable when basic communication is breaking down and care for children disappears overnight?
Minister of Health.
Thank you so much, Honourable Speaker. Thank you to the member for the question. It is clearly a very stressful situation for families in Kelowna and the surrounding region to know that the pediatric unit inside Kelowna General Hospital is going to be unavailable for about 6 weeks. It's a very difficult decision that Interior Health has undertaken. And I want to reassure people, because the member is not correct in her characterization that there are no pediatric services available at this hospital. Mr. Speaker, indeed there are, and I want everyone to know that critical care services for children and for babies remain open at Kelowna General, and in fact, people should continue to take their children there in the case of an emergency. Mr. Speaker, 10 pediatric beds are temporarily closed to ensure the safety of children in the most dire sets of circumstances. Mr. Speaker, I've spoken to Interior Health. I know that this decision wasn't taken lightly. They do have a shortage of pediatricians inside the hospital right now. Mr. Speaker, the good news is that there are 2 pediatricians that have signed contracts. One starts in July. Mr. Speaker, there are 3 associate physicians in a pediatrician program that are coming. They are also going to in July and August. And Interior Health continues to do everything they can. In fact, Mr. Speaker, this weekend, a pediatrician from the U.S. is visiting Kelowna to see the community, make a site visit, and hopefully make the decision to move here. So, Mr. Speaker, we know we're facing a global healthcare worker shortage, including pediatricians, and that's why we're going to continue to do everything we can to ensure that this service is available in Kelowna.
Member supplemental.
Just hope our kids stay healthy until July.
Member, careful with your words. Members, hold it, calm down, calm down.
Physicians are raising the alarm. There's no coverage plan, no extra support, and no additional resources. Nurses are overwhelmed, and ER doctors are being forced to cover pediatric emergencies without training. One doctor said, quote, "I guess I'm a pediatrician now," end quote. Will the Premier finally take responsibility for this collapse and direct the Minister of Health to meet with frontline doctors immediately?
Minister of Health.
Thank you so much, Honourable Speaker. Once again, I must correct the record. Mr. Speaker, any parent with a child in need of emergency care can and should continue to go to Kelowna General Hospital, where their child will be assessed, Mr. Speaker, and will be cared for. Mr. Speaker, let's acknowledge the incredibly hard work that pediatricians are undertaking in Kelowna and acknowledge that it is a very tough situation for them. The burnout that they are experiencing, the moral distress that they are facing, that is why a difficult decision is taken to ensure that the emergency services that are need to be there for children remain there. Mr. Speaker, I've just outlined the pediatricians that are coming to Kelowna. Mr. Speaker, I've just outlined the pediatricians that are coming to Kelowna. The work that Interior Health will continue to do to...
Members, Minister, please conclude.
You know, Mr. Speaker, what pediatricians and healthcare workers in Kelowna, families, community members need right now is our support and our assertion that we are all doing everything that we can to make sure people have the right information about the care that's available at the hospital, that families continue to take their children there, and they know that we are doing everything we can to address this, and that we'll continue to support the hospital, to support Interior Health, and to support families in Kelowna.
Member for West Kelowna Peachland.
Thank you, Mr. Speaker. A Kelowna doctor and parent posted a video exposing what Interior Health won't admit. This isn't a doctor shortage, it's a full-blown pediatric care crisis. This unsafe staffing model forces one pediatrician to cover the ward, psychiatric care, emergency, the NICU, and high-risk deliveries all at once. Shame. For years, they've been raising alarms, but as that doctor said, and I quote, "Their voices have been silenced," unquote. How does this Premier expect one doctor to be in 5 places at once?
Minister of Health.
Thank you, Honourable Speaker. It is an incredibly challenging situation to be a pediatrician at Kelowna General Hospital right now, where a full staff complement would be 12 and there are 6 working, and they are working as hard as they possibly can, and I know that, Mr. Speaker. That's why, in order to ensure safety for children, for patients, that's why a difficult decision was made to remove temporarily the services in hospital for pediatric services, but to keep the emergency services open, to keep the NICU open, to keep the critical care services that are needed for children. Mr. Speaker, I'll say it again. Families in Kelowna need to continue to take their children to Kelowna General Hospital. Mr. Speaker, I'll say it again. I'll say it again. Interior Health is working hard to undertake the hiring that they need to do. They're seeing successes with new pediatricians signing contracts.
Members. Minister has the floor. let her conclude it.
Mr. Speaker, they're looking at compensation, locums, remuneration models, everything that they can do to bring in people to fill these positions, even if on a temporary basis, to ensure that these services are here for people. Mr. Speaker, it's a global shortage of healthcare workers. Mr. Speaker, you know, Mr. Speaker, we have had an...
Members.
Mr. Speaker, I heard the member across the way say closing down hospitals. I just attended the opening of a brand new hospital in the leader of the opposition's riding.
Members will come to order now. Member, you're wasting your time. We are not deducting this time out of your question period today. Members, come to order. Minister will please conclude.
Thank you, Mr. Speaker. The situation at Kelowna General Hospital is a very difficult one, and we are going to continue to do everything we can to fill those positions, to put physicians in place, and to ensure that the services are there for the families of Kelowna.
Member for Courtney Comox.
It's not just pediatrics in Kelowna, Mr. Speaker. West Coast General Hospital in Port Alberni has had week-long ICU diversions going on for the better part of a year. Wow. This has caused dramatic hospital shortages in this minister's own riding for weeks at a time. Losing hospital doctors to general practice under the longitudinal payment model has severely impacted the staffing of GPs working in hospital settings. Why is this government trying to fix healthcare access by destroying BC's emergency departments?
Minister of Health.
Thank you so much, Honourable Speaker. Wow, I just don't know where to start. I cannot believe.
Okay, member for Abbotsford South, you have made your point. Everybody heard it. Don't worry.
You know, Mr. Speaker, this entire session, I have been standing up and talking about all the actions our government is taking to strengthen our public healthcare system. Mr. Speaker,
Members.
Opening a new medical school in Surrey, Mr. Speaker, adding more seats at UBC's medical school, Mr. Speaker, making it easier for physicians to move to British Columbia and be credentialed to practice here. Mr. Speaker, a longitudinal family physician payment plan that fairly compensates family doctors for the work that they do. Mr. Speaker, I know the opposition doesn't like hearing about the track record, but we've got to go there, Mr. Speaker.
Members.
Let's just...
Hold it, Minister. Member for Kamloops Centre, please let her conclude it. I know it's only 2 days of the session left. Let's do it.
Mr. Speaker, over the last 2 years, we've added 1,000 family doctors. We have the highest. We have the highest number of physicians per capita of any major family physicians of any major province in Canada. Mr. Speaker, who remembers GP for me? Mr. Speaker, when the opposition leader sat on this side of the House, he made a promise to British Columbians that they would have a general practitioner by 2015.
Members, Minister, it's okay.
All right.
Thank you.
I'll finish on the next question.
No, thank you. Member, you have supplemental?
Mr. Speaker, I'd like to remind the minister that net new doctors was 440 in estimates just weeks ago. So let's make sure that we're talking about correct numbers. Also, I'd like to say that unintended consequences are still consequences. We know the minister's working on it. But this government's actions have resulted in hospitals pulling ER doctors off the floor to cover other short-staffed positions in the rest of the hospital. This is causing even more acute hospital ER closures and diversions, whether intentional or not. Why is this minister's solution to our chronic healthcare worker shortage to treat it like a Jenga puzzle that's on the verge of collapse?
Minister of Health.
Thank you so much, Mr. Speaker. The member speaking about emergency room closures, which are obviously very challenging situations for any community to face. The good news is that the big picture shows us that we are moving in the right direction. And in the first quarter of this year, emergency room diversions are down a quarter compared to, that's 25%, compared to the year before, Mr. Speaker. But we know that we continue to see pressures in specific communities, and I acknowledge that. That's communities like Lillooet, communities like Burns Lake, communities like Mackenzie. And Mr. Speaker, that's why health authorities work so hard to bring in locums, to take the steps that they need to attract physicians into these communities, to make sure that the number of doctors is there to keep these emergency rooms, these vital services, there for communities. Mr. Speaker, I know they don't like the phrase global healthcare worker shortage, but it's true. Every single province in Canada is experiencing this issue. But Mr. Speaker, British Columbia continues to lead the way in terms of attracting physicians, bringing in new physicians from other jurisdictions. Mr. Speaker, we continue to lead the way at adding family doctors into practices here in British Columbia. We continue to lead the way in building new medical school seats, hiring more nurses, doubling the seats of nurse practitioner training spaces, Mr. Speaker. These are the actions we have to continue to take. This entire session, we have talked about all of the actions that this government is taking, and we have heard no new ideas from that side.
Member for Fraser-Nicola.
Thank you, Honourable Speaker. We've raised the alarm on rural ER closures many times, but this government still hasn't fixed the crisis. The Lillooet ER just shut down for the 31st time this year, and for the entire weekend as well, when we need it the most. Residents are being told to drive 2 hours to Kamloops or call 911 and hope for the best. In what emergency do you have 2 hours to waste waiting for help? When will this Premier stop abandoning rural British Columbians who are hours away from help?
Minister of Health.
Thank you, Mr. Speaker. Thank you to the member for the question, and thank you also to the member for a really constructive conversation in my office this morning. I really appreciated it, because that's how we can work together. Mr. Speaker, my promise to rural British Columbians is I will never abandon them. Mr. Speaker, I will continue to fight hard, do everything that I can to support all of the work that communities are taking, that health authorities are taking, that unions are taking, that our government is taking to bring in more healthcare workers to rural communities, because people living in British Columbia's rural communities deserve the same access to healthcare that anyone anywhere in British Columbia does. So I can assure this member that I will continue to do everything that I can in supporting Lillooet. Mr. Speaker, we will continue to focus on Lillooet as one of those places that has had particular challenges. Mr. Speaker, the good news is that 1 new physician was hired in April and 3 more are coming this summer. Mr. Speaker, it is going to take all of us pulling together to show physicians who want to move here that rural BC is a fantastic place to live. I need their help, Mr. Speaker, and I hope I get it.
House Leader of the Official Opposition.
Thank you, Mr. Speaker. Unfortunately, with all the canvassing of the crippling healthcare system in British Columbia, we've heard a lot from this minister and from this government about what's about to happen, about numbers that are spun in their favor, about numbers that frankly don't add up to what we're seeing as the reality in hospitals all across British Columbia. We have said time and time and time again, personal stories, ER closures, pediatric wards are shuttered. I have a child, I have kids, and I know if I were forced to drive 4 to 6 hours to the next ER, that would be the most 4 to 6 of the most terrifying hours of my entire life. And no one should have to go through that. When people are in crisis, every minute feels like an hour. I'm getting there, Mr. Speaker, but I just need a minute, because every time you say that something's improved by 25%, well, you didn't have that far to go when it was in such a dire position to begin with. So it doesn't feel that good to us on this side of the House and what we're hearing from our constituents and people that are suffering. So my question is, with rural ERs closed, hospital hallways that are overflowing, seniors that are left to languish for years without care, the pain, abandonment, and preventable deaths that we're seeing across British Columbia, will the Premier admit that this isn't isolated, that this is in fact a collapse, and explain how this government let it get this bad? Yeah.
Minister.
Thank you so much, Honourable Speaker. The member asks about what has happened, and I'm going to say there's 1,000 new family doctors since 2023. There's
Members,
almost
please.
700 people every single day being attached to a family doctor. But, Mr. Speaker, in the last 6 months, here's what's happened in the last 6 months. 2 new hospitals in Terrace and Fort St. James. 3 new urgent and primary care clinics in Langley, Nanaimo, and Williams Lake. A new tower at the Lions Gate Hospital, Mr. Speaker. A new Allied Health Centre in Victoria. A new mental health and substance use centre in Victoria. 2 new treatment centres and recovery centres at View Royal and Prince George. Mr. Speaker,
Members.
when the Leader of the Opposition sat on this side of the House, he said no. He said no to a new hospital. He said
Members.
no.
Members.
He said no to a new medical school. Mr. Speaker, this side of the House knows what needs to be done. We are doing it, and we will not stop.
The bell ends the question period.